Today we will talk about management of epistaxis. So first of all we will take history. So there we will take mode of onset. We will ask patient mode how it has been started. Is it spontaneous or fingernail trauma, duration, frequency, amount, site and any previous bleeding. Any history of nasal trauma, purulent nasal discharge, whether bleeding is of anterior or posterior type, any known bleeding tendency in the patient or family, like family history we will take for bleeding, history of known medical ailment like hypertension, leukemia, mitral valve disease, cirrhosis, nephritis, history of drug intake and analgesics, anticoagulants, etc. And in general examination, we will see for pallor, pulse, BP, blood pressure, neck, lymph nodes. In local examination, we will check for anterior and posterior rhinoscopy. Will to determine will do anterior and posterior rhinoscopy to determine site and any local causes of bleeding. Systemic examination we will check in CVS and respiratory examination, liver and spleen and kidney. Investigations we will do like complete hematological examination, that is we do hemoglobin count, TC, platelet count, PCB, BT, CT, blood sugar. Blood grouping and cross matching we will do. Diagnostic nasal endoscopy, CT scan paranasal sinus, ECG. Treatment for epistaxis. First aid can be given. If patient is in shock, immediate resuscitation is required. If resuscitation measures are not required, bleeding is controlled by pinching the nose, nostrils, and anterior cartilaginous part should be pinched with thumb and index finger for about 7 to 10 minutes to compress vessels of the little's area. Trotter's method. Patient is in sitting position, mouth opens, allowing bleeding to continue till hypotension develops. Has risk of this can has have risk of developing coronary thrombosis. Cold compression may also help by reflex vasoconstriction. So when the vessels are contracted, low amount of bleeding will be less. Cauterization useful in anterior epistaxis when bleeding uh, has been located. Cotton wool soaked in a local anesthetic like 4% xylocaine is placed over the bleeder for few minutes. Cotton wool is then removed and cautery is done with with either chemicals or by electric means, electrocautery. Chemicals used for cautery are silver nitrate 10%, trichloroacetic acid 50%, phenol chromic acid. Anterior pack Anterior pack is done in cases of um, when there is bleeding from Little's area. If pinching fails to control epistaxis and bleeder is difficult to identify, a patient is admitted to hospital and anterior nasal packing is done. To avoid pain during packing, um, topical anesthetic like 4% xylocaine is applied to nasal cavity. Ribbon gauze is smeared with um, bismuth iodoform. Bismuth iodoform paraffin paste (BIPP) is packed gently but tightly into the nasal cavity. Liquid paraffin plus antibiotic cream gauze, Vaseline gauze, uh, Merosil tampon, Simpson balloon may also be used. Packing is done layer by layer from floor to the roof and from before backwards. Pack is removed after 48 hours and patient is kept under observation for another 24 hours. If first packing fails to control, then the packs are removed and nose is repacked again. Systemic antibiotics should be given to prevent sinus infection and toxic shock syndrome. Now we come on to posterior packing. Posterior nasal packing. It is required from bleeding profusely into the throat. A postnasal packing is first prepared by tying three silk ties to a piece of gauze rolled into the shape of a cone. A rubber catheter is passed through the nose and its ends are brought out from the mouth. ends of the silk thread are tied to it and catheter pulled back from nose catheter pulled back from nose back which follows the silk thread, now guided into the nasopharynx with the index finger. Anterior nasal packing is also done. Once the post nasal packing is done, are once the post nasal packing are in place, anterior nasal packing is also done from the front side. Uh, Packs are usually removed after 72 hours. Here in this picture you can see anterior nasal packing and posterior nasal packing. In this anterior nasal packing, ribbon gauze is placed from floor to floor to roof, and posterior nasal packing catheter is placed. And in posterior nasal packing is done from both the sides. Surgery, arterial ligation by external approach, external carotid artery ligated in neck, um, distal to superior thyroid artery, internal maxillary artery. In internal maxillary artery ligated to pterygopalatine fossa, Cadwell Luke operation. In anterior to posterior ethmoidal artery, it is ligated in orbit, Lynch Howard incision. We second we do angiography and embolization. We also do submucosal resection of septum, septodermoplasty for hereditary telangiectasia, and endoscopic cautery and clipping of sphenopalatine artery, anterior or posterior ethmoidal artery.